Good evening and welcome to our virtual program, COVID-19 and Parkinson's, What You Need to Know. We are very grateful to have Dr. Hooman Azmi and Alana Klar with us this evening. Dr. Azmi is the director of the Division of Functional and Restorative Neurosurgery at Hackensack University Medical Center. His goal has been to develop a program that delivers a very comprehensive approach to the care of patients with Parkinson's disease. From promoting engagement in health and wellness to offering the most current medication therapies to making available surgical options such as deep brain stimulation and beyond, the program strives to ensure the best quality of life possible for each and every patient. Recognizing the particular vulnerability of patients with Parkinson's disease, Dr. Azmi has spent the last 10 years helping to develop innovative hospital-wide protocols and programs to improve the care of patients with Parkinson's disease who have been admitted to the hospital. He leads the team at Hackensack, whose efforts have culminated in Hackensack becoming the first hospital in the nation to receive disease-specific certification in Parkinson's disease from the Joint Commission of Accreditation of Hospitals in June of 2018. Dr. Azmi has authored and co-authored several articles in scientific journals and has been an invited speaker nationally and internationally. He has co-authored a book entitled Parkinson's Disease for the Hospitalist. It was released in October of 2018. Dr. Alana Klar is one of the most highly trained neurologists in the country for the treatment of movement disorders. After completing her residency at Georgetown University, she completed a 2-year movement disorder fellowship at Mount Sinai Beth Israel Medical Center, where she obtained subspecialty training in deep brain stimulation. She treats all types of movement disorders, including Parkinson's disease, atypical Parkinsonism, essential tremor, hemifacial spasm, vocal motor tics, just to name a few. Dr. Klar is dedicated to improving care for patients and spreading awareness about Parkinson's disease and other movement disorders. She is a firm believer in integrative medicine and the complementary role exercise, nutrition, and alternatives therapies play in helping patients maximize their quality of life. Dr. Klar has participated in groundbreaking research for the treatment of Parkinson's disease, including serving as a sub-investigator for the Parkinson's Progression Marker Initiative, a landmark observational study that helped identify biomarkers for the progression of Parkinson's disease. She often speaks to both professional and patient communities to promote education about Parkinson's disease and other movement disorders, and to advocate for patients, families, and caregivers. At this time, I would like to turn the program over to Dr. Azmi.
Thank you so much, Robin. I hope you can hear me well. Just wanted to thank everyone for signing up and spending the evening with us, so we could review a little bit about what is known for patients that have Parkinson's disease in relationship to COVID. So it's going to be a back and forth discussion between myself and Dr. Klar, and we'll certainly open it at the end to discussions. You know, a lot of these questions are questions that we are asked by our patients. So we thought this is a need for it in the community in terms of very specific questions about COVID. So without delaying further, let's get started. So, you know, this has been a, hold on one second. So what is COVID-19? I mean, this is, it's almost, you know, universal how much everybody has heard about COVID. It's consumed our lives for the past year. We've lost friends, we've lost colleagues, family members, perhaps, or at least they've, some people have been really ill. People have lost their livelihoods. It's been a really unprecedented time in our history. But thankfully, it looks like we're turning the corner, and it's important to get as much information about this as it relates to Parkinson's disease, so we can best protect ourselves and make sure we have accurate information. So COVID-19, as we all know, it is a viral disorder that is caused by a virus that has wreaked havoc worldwide. So just a recap of what we've gone through. It seems like a distant memory, but on December 31st, in 2019, China reported its first cluster of cases with COVID, and it was really unclear what it was. At that point, we were just recapping the history of what's happened to the world. And in January 19th, almost 20 days later, the first case was reported in the US, in Washington State. And in March 4th, a little bit after that, the first patient in New Jersey was diagnosed. So the first patient in New Jersey was diagnosed, and we've lost over 22,000 patients in New Jersey, and in the U.S., almost 600,000 people have passed away from this disease, and worldwide, almost 3 million people have died. So it's really been an unprecedented event in our lifetime, for sure. But there is light at the end of the corner. So we have a vaccine, the distancing, the social distancing, all of the healthcare precautions that have been done really are starting to make a dent. So nearly 100 million people have been vaccinated in the US, 1 billion worldwide. So that's all positive. There is light at the end of the tunnel. But so coming back to Parkinson's disease and COVID, let's kind of recap what we know about what's been happening to patients with Parkinson's and what are the risks for patients with Parkinson's disease. So we're going to present to you some of the data, some of the research that has been published, with understanding that we're still new at this. There's only been a year or so of published information. So what we know is basically what's been available and what's been published. So we'll review that with you. So again, these are questions that we've been asked from our patients. So we thought it's a good way to discuss the implications of COVID for someone with Parkinson's disease. So the first question is, does COVID-19 cause Parkinson's disease? So I'm going to go to the next slide. Dr. Clark, can you see this?
Yeah. So this is just a screenshot of a few papers and reviews that essentially are pointing out we don't have any evidence to support the stipulation that COVID causes Parkinson's. But as is the case with any insult or any injury to the body, including but not limited to COVID, we do know that motor and non-motor symptoms of Parkinson's can be exacerbated when you have some type of infectious disease process going on.
Yeah, so I mean, the bottom line is initially there was a few cases of abrupt diagnosis of Parkinson's disease in someone that has had COVID, but I think the consensus right now is that there really is not an established link. I mean, people are looking at it, but there's really not an established link at this point. So we'll go to the next question. And The question is, if I have Parkinson's disease, am I at a higher risk of getting COVID? That's a very good question, because it is something that we face every day, so again, there was data all over the place, but I think looking at what's been published overall, these authors put out a kind of a review of what's been published out there in terms of our patients. It does not show essentially that there is an increased risk of someone with Parkinson's disease getting COVID. It doesn't seem to be any different than someone that does not have Parkinson's disease. So that's kind of the consensus at this point. And let's see some of the other studies that have come out. I don't know, Dr. Clark, if you want to take this one.
Sure. So again, I think as you already pointed out in this succinct description, in this study from Spain, they really only found that Parkinson's patients' risk for getting COVID was only increased if they were in the setting of a nursing home or if they had some type of underlying cancer.
That's correct. That's correct. And again, take this with a grain of salt. This has been a rapidly moving target, and there were early studies that showed certain things. For example, this one, that patients in nursing homes perhaps were at higher risk. But looking at the data overall, the first study that we showed you, that's definitely does not seem to think that people with Parkinson's have any higher risk of developing COVID than anyone else. And here's another report that came out kind of midway in the pandemic, COVID-19 and Parkinson's disease reporting prevalence and outcome. It was a large study of patients in the Italian city of Piedmont, and they found that there is really no increased risk of getting COVID if you have Parkinson's disease. So I think that kind of puts that question to rest. We'll go to the next question that comes up a lot. Does having Parkinson's disease make COVID-19 more dangerous?
Or put another way, does COVID increase the risk of death if you have Parkinson's underlying?
Right. So these are a couple of articles. Basically, if Dr. Clark, what's your thoughts on these?
Right. Well, as you had pointed out, initially some articles thought that there was, in fact, a higher risk of mortality when contracting COVID if you did have underlying Parkinson's. But as we obtain more information, I think the general consensus became that the mortality risk wasn't so much because of the COVID, the virus itself, but having very advanced Parkinson's and just being a very frail patient at baseline. And I think that this was supported with some of the other studies that you're going to show in some of the other slides.
That's correct. I think that's a good point. Some of the studies may have shown higher mortality for someone with Parkinson's disease, but the consensus, as we see it, is that it really was in patients with advanced disease that had a lot of other comorbidities. And we know that COVID is very dangerous in people that have other medical conditions, more advanced medical conditions. So it kind of was parallel to that finding. So here's another study also out of Italy. This is from Bologna. I think, if you remember, Italy got hit very, very hard with COVID. So a lot of the early data we have is from there. And this study essentially looked at almost 700 patients with Parkinson's disease. And they did not see a higher rate of hospitalization with PD or risk of death. So that's reassuring that in a large patient population, the risk of having to be hospitalized because of COVID or God forbid dying because of COVID did not increase if these patients had Parkinson's disease.
Mhm.
And there's also another study, again, out of Italy, although this was also spearheaded by University of Toronto, but the majority of these patients were from Italy. Dr. Clark, if you want to review this, I'll put all the data up.
Yeah, so 117 patients that had COVID, and the overall mortality was around 20%. But again, reaffirming that the reason that those patients ultimately passed was just because of the underlying advanced state of their condition, of their Parkinson's, not so much because of the COVID virus.
Yes. So again, reiterating the prior studies that the higher risk for patients was what we would expect for someone with a lot of medical issues, not necessarily because they had Parkinson's disease. So the next question that we get asked a lot, I'll put it up. So this is an interesting question. If I have Parkinson's disease, and if I get COVID, does that make my Parkinson's disease worse? And this is a lot of studies came out on this, and I'll let Dr. Clark take the first one.
Yeah, so I mean, again, we know that there hasn't been enough information. We've only been dealing with this for a year, so we don't have any long-term follow-ups about Parkinson's patients who contracted COVID. But in this one article that just looked at 10 patients, it again stated that the mortality rate was higher when the patients were older, more frail, had more comorbidities, and for those that contracted COVID and ultimately recovered, it took much longer to get back to their baseline.
Correct. So to summarize, what they did find was not that people with their Parkinson's disease got worse, it just took people longer to recover because of the Parkinson's. So that's also another reassuring finding. Here is an article that and this we see a lot of, which is unfortunate, is the overall effect of the pandemic on the Parkinson's community. Not necessarily when a patient that has Parkinson's gets COVID, but this is all patients with Parkinson's disease. How has the pandemic affected their life and their quality of life? And there are multiple studies that are coming out that show that it really did affect their quality of life. They had a decline in quality of life during the pandemic, and for several different reasons. So some of the other articles kind of show that. This is Dr. Clark. This is a study, I think, from Italy.
Right. Again, I mean, as you mentioned, several aspects of patients' quality of life were impacted as a result of the pandemic. One of the biggest ones was, of course, physical activity, because everything shut down and people were isolated. And in Parkinson's, it's very critical to stay physically active to combat a disease that's trying to slow you down. And so in this particular study where they had surveyed 74 patients, 60% did report significant worsening of their general condition as a result of not being as physically active. And yes, they did find ways to try to adjust for that. And many people, ourselves included, now that we use Zoom, had to rely on technology. And so that was also applied to having the ability to do some type of physical activity at home and relying on assistance with going online.
So would you say in your patient population, you've noticed the same kind of effect of the pandemic?
100%. I think that, it's unfortunate because our patient population is so vulnerable and it's such a critical component to their overall management and not just their physical well-being, but their mental and emotional, because a lot of the physical activities that they do tend to be communal with classes or therapy. So this was absolutely reinforced on a personal level and absolutely reflected what we were reading in the papers coming out.
That's true, and I think we can say the mirror effect of that is how important it is to have the community and have the physical activity and all of the things that Parkinson's doctors across the nation prescribe for patients, that how important it is. And we saw that with the pandemic, when they were gone and patients couldn't get to these things, how rapidly their quality of life declined. So that this kind of reinforces those things for us. Here is a study looking at impact of home confinement during the pandemic on sleep, for example. And one of the things, and this is from India, they looked at 832 patients and they surveyed patients because during this time, many patients couldn't even get to the office. And they found that home confinement, not being able to leave the home, was significantly associated with new or worsening patterns of sleep. And among PD patients, the lack of sleep was, of course, associated with worsening of the quality of life, and then we know that from our experience with Parkinson's disease. The physical activity for greater than an hour a day and adoption of new hobbies during the home confinement were associated with better sleep. Again, interestingly, how even in the middle of pandemic, people found ways to be active, develop new hobbies, and that seemed to help. So we should take lessons from that. Let's see. Also, here's a study from actually Korea, about exercise patterns and the pandemic. So, Dr. Clark, I don't know if you would like to
Yeah,
talk about that.
I think this study from Korea also reinforces some of the same points. I know it might seem repetitive, but I think the reason we sort of hammer the point across is because it's just such an active, integral component to a Parkinson's patient's care after diagnosis. And during the pandemic, because everything shut down and people had to adapt, and it wasn't, perhaps initially so easy to do, people had noticed significant changes, worsening really with motor and non-motor symptoms, and exercise, had to be creatively readdressed another way, despite being at home, despite being isolated. So I think, one of the silver linings about this whole situation is now that we've made going online the norm, there are a lot of fantastic organizations that do have videos where patients can do safe home exercises on the floor, in the chair. They don't need any fancy equipment. They don't have to go to a rehab facility. And that isn't to undermine that those places and those types of classes still have their are still important, that they still have their place. But there's definitely a lot more information now and a lot of visual tools that are available online for patients now so that they can maintain exercise at home.
Very important point, very important point. And I think the lessons that the Parkinson's community will learn or has learned from the pandemic will carry beyond the pandemic. Exactly what you just mentioned, the ability to engage, remotely or virtually. I think, look what we're doing now. We're able to communicate across the state, and this really wasn't not even popular, not even possible before the pandemic. So there are lessons that we have learned and will learn to expand on. So let's go to the next study. So again, this is not to belabor the point, but also these studies demonstrate the same thing: changes in Parkinson's symptom because of the lockdown, not necessarily because somebody had COVID, but because of the unavailability of the resources and lack of utility of these resources. And here's 96 patients that were interviewed. The quarantine caused worsening in cognition and behavior and motor symptoms in patients with PD and other similar disorders. And they come up with a proposal to implement strategies to contain the effects of quarantine. What that has been done: the virtual access, the virtual communities, to give tools to caretakers and patients with Parkinson's disease to be able to bridge these gaps. Another report again. Access to medications has been a problem. I don't think we need to kind of delve into that too much. And finally, effect of the pandemic on people with Parkinson's disease. And this is a large survey. I don't know if Dr. Clark, you would like to discuss this.
Well, this reinforces the same point. And I think what's impressive about this is just the number of people that they were able to glean information from in the survey. 51 of them had contracted COVID, but they all reinforce the fact that the pandemic and, on top of that, the experience of having COVID, but that's a small fraction of those who had PD, right? Or sorry, the PD patients who actually contracted COVID were a small fraction of the larger patient population who just were dealing with the aftermath of the lockdown and the pandemic. And all of them had difficulties with motor and non-motor worsening and disrupted medical care and emotional issues with their social isolation and their activities being shut down.
Right. So this is a question that we get, but let's just quickly recap what we talked about. So it's been shown that the Parkinson's, people don't get Parkinson's from COVID. But what can happen is, because of the lockdown and because of unavailability of resources, people that have Parkinson's disease can have their symptoms worsen. And we need to be aware that caretakers, physicians, to be able to engage our patients and make sure we address these gaps. So I think that's a takeaway of what we discussed. Now, very important question that we get from patients: can I get COVID from the vaccine? And Dr. Clark, would you like to answer that?
Yeah, you cannot. So these
very important.
Very important. Yeah, you cannot get COVID from the vaccines. These vaccines do not contain a live virus. If some of you have been paying attention to the news about the exciting technology that was utilized for the Pfizer and Moderna vaccines, they are what's called mRNA vaccines. And even though these vaccines were brought to market in an expedited fashion because of the pandemic, the technology behind these mRNA vaccines were actually around for a long time. And essentially, these vaccines just carry instructions for the body to create a protein so that we can basically mount an immune response to something that looks like the COVID virus, but is not. So you cannot get COVID from the vaccine.
Yeah, very, very important. Here's another question. I have Parkinson's disease. Is it safe to get the COVID vaccine?
Absolutely. The only reason not to get the vaccine is if you've actually had a severe allergic reaction to a vaccine in the past. And, barring that, if you have other medical comorbidities or underlying conditions that have you immunocompromised, then you have to have a discussion with your doctor. But as a general matter, anybody with Parkinson's, it is absolutely safe to get the COVID-19 vaccine.
Yep, and this study actually says exactly what Dr. Clark says, that the large Parkinson's physician community and provider community is recommending that patients with Parkinson's get the COVID-19 vaccine. So here, this is another question we get. I have Parkinson's disease and I had COVID. Should I still get the vaccine? So the answer to this is yes. There's no difference in someone with Parkinson's or without if you've gotten COVID. The recommendation is that you have to wait at least 14 days after the symptoms are gone, and then you can get the vaccine. And unless someone's received plasma as a therapy. And then the recommendation is you should wait 90 days before you get the vaccine. But that's really what the consensus is, right now on if to get the vaccine should someone have had COVID. Next question, how does a vaccine work? I think maybe we can go to the question answers, but very quickly, I think Dr. Clark mentioned it. This, I don't know if this comes up on the screen, but those red little spikes are called the spike proteins on the virus. This is a example of the virus, and the vaccine is basically just those, it's a representation of those spikes to the body. So the body makes antibodies to be able to attack that. So it's a fairly complicated, but really that's what the vaccine does. And here's a picture of the antibodies attacking the virus. So I think we're running a little bit over. We talked a lot, but it was important discussion to have. And I think we have some time for questions.
Absolutely. There's a chat box, so we'd love to hear from some of the participants if they would like to type in some real-time questions that we can answer. But until we get some of those questions, we thought it might be a good idea to also review some of the questions we most frequently hear from our patients in the office. And also we can discuss some of the questions that we already received from the registration. So one of those questions was, how can we help our elderly patients with Parkinson's engage in conversation both in person and on the phone? That's a great question. And I think, you know, again, in the midst of the pandemic, that was more difficult because everybody was isolated. And so if you don't have something in person complementing a conversation on the phone or over FaceTime, you know, it's a little bit challenging. But I think the idea is to just find any way to stimulate or engage your parents with any topic or activity that has them excited or interested. And always trying something new is a great idea. Learning something new is always a great idea. And considering outside community support groups. Many times patients that didn't participate in those settings sought that out as a result of the pandemic because of increased isolation. And a lot of the support groups went online and are now doing these Zoom meetings just as we are having them tonight. And it's really nice to be able to talk to people who know what it's like to be in your shoes. And sometimes that can pull out some more conversation.
There are some questions on the Q&A. There's a couple of really good questions.
Yeah. Do you want to add or do you want to answer that first one, the can the decline?
Yeah, sure. So an attendee is asking, can the decline that resulted from the pandemic be reversed? If so, then how? Is there, if there's no definitive study that can offer a conjecture? So, I mean, the answer is we could certainly try. We know what the important points are for treatment of Parkinson's disease. We know how important it is to be physically active. So all we can do is to try to revert to that mode again, to try to encourage physical activity, encourage community involvement, support group involvement, and at least the studies that we looked at, there is, I mean, there are early still, but there's no indication that these are permanent declines. So I think that the hope is there. So that's one question. The other question, I think that it's maybe you would be much better at it than I am, Dr. Clark. What is the difference between PD and Parkinsonism?
So I think the simplest answer here is thinking about Parkinsonism as an adjective. So Parkinsonism as an adjective just means that somebody has symptoms of being slow and being stiff. And when you are slow and stiff, you can have other symptoms or other features as a part of your clinical picture, but those other features may not be present in what we consider typical PD or typical Parkinson disease. When we define typical Parkinson disease, it means that you are slow, you are stiff, you may or may not have tremor. That is not a requirement for the diagnosis, but you have a predictable response to carbidopa-levodopa, which is our the standard medication that we prescribe, and you really don't have any strange or severe symptoms at the beginning of the disease process. So Parkinsonism, again, is just an adjective for being slow and stiff. Typical Parkinson disease, or PD, just means that you have those symptoms, you have a predictable response to medication, and you have a long disease course.
There is we had some submitted questions. One question that actually kind of reflects what we always are asked by patients and even other physicians is, do you need to have a tremor to be diagnosed with Parkinson's disease?
No, absolutely not. That is not part of the cardinal criteria to diagnose it. So we do have plenty of Parkinson's patients that have tremor, but there's a whole patient population of individuals that do not have tremor. They are simply, again, slow and stiff, and those are the main features by which we diagnose Parkinsonism.
And speaking of tremor, tremor could be something very minor, or could be quite debilitating, where people's quality of life is affected. They can't brush their teeth, they can't feed themselves. What is your thought process in terms of treating someone with tremor, whether it's essential tremor or Parkinsonian tremor? What is the algorithm you go through?
So the algorithm is really quite simple. I mean, if it is benign, then you can do nothing about it. If it's moderate and you want to try medication, you sort of exhaust the list of medications that are out there. And if it's severe, there are surgical options that are available. One is invasive, but it has been around for a very long time. This is deep brain stimulation, and we know that it can very successfully treat tremors, regardless of whether it's due to Parkinson's or essential tremor or really any other kind of tremor. And more recently, we are starting to implement a non-invasive or incisionless form of intervention using ultrasound waves. And I think it would be great if you actually talk more about that.
Sure. I mean, there's another question about focus ultrasound. There's a lot of news in the media, and some interesting stories about focus ultrasound for tremor. So what that is it is a new tool, not necessarily that new. It's at least 5-6 years old, that gives us the option to treat someone with a tremor, whether it's from Parkinson's disease or from essential tremor, with an outpatient procedure with sound waves, essentially. And it is incredibly interesting technology where we're able to aim the sound waves on the circuitry that causes a tremor, and by disrupting the circuitry, the tremors are instantly taken care of, and patients go home without the tremor the same day. So it really has allowed us, or is bringing a very interesting additional option for treatment for someone with tremor. So that's what focused ultrasound is.
And is Hackensack going to be offering that
Oh,
procedure?
yes, actually, the option will be available starting June. I think they're just doing the final construction for it. So the option will be available in June, and we'll be offering it to our patients. In fact, we're evaluating patients right now, because there's certain tests that are needed to make sure someone is a candidate. Hopefully, first week of June, we are planning our first patients.
Very exciting.
It is.
So I think that essentially concludes our talk. We really appreciate everybody that joined us again tonight. I'm going to hand it over again to Robin.
Yes, thank you so much, Dr. Azmi and Dr. Claire. That was awesome. It was a great program. It was very helpful and informative. And I thank everyone else for taking their time to join us this evening. I do see one other question came
Yeah.
in.
Saw that. Yeah.
Yeah, so why don't you guys answer that, and then I'll wrap it up after that.
Sure. The question is, except for the tremor, are other symptoms of Parkinson's treatable? So absolutely. With medication, we can treat a lot, if not most, of the symptoms of Parkinson's, both motor and non-motor. But when it comes to surgery, deep brain stimulation can treat a lot of motor symptoms of Parkinson's. So not just the tremor. Deep brain stimulation can target the slowness, it can target the stiffness, and it can target the side effects from the medication, what we call on-off fluctuations, where patients experience a roller coaster of having the medication kick in and wear off. And so you can sort of smooth out those highs and lows with the deep brain stimulation procedure. But the ultrasound procedure only is focused on addressing the tremor.
What I would add to that, and I think Dr. Clark explained that very well. I would like to add to that, though, it's really important, if you think that you have Parkinson's, or a family member or a loved one thinks they have Parkinson's, to seek a Parkinson's specialist, a movement disorder specialist, to properly diagnose and properly start you or your loved one on the appropriate treatment for Parkinson's. I think that's really critical, and the objective of a movement disorder specialist isn't, surgery or focused ultrasound. Is really the best way that we can restore quality of life, whatever it takes. And often it is only medication. Often we treat these just with medication, being very also aggressive with activity and therapy and all the things you heard Dr. Clark spoke about. But then we have these other options as well when the medications become not as effective, or people develop side effects from. So it's really important to see a movement disorder specialist to get a comprehensive view of what the diagnosis is and what available options there are.
Absolutely.
Great. Thank you so much for answering that question. So again, I'd like to thank Dr. Azmi and Dr. Clark for this program. It was so helpful and informative, and I'm hoping that everyone who was on, enjoyed it as well. Please watch your email for an evaluation form of this program, as well as a link to the recording for the webinar. Like I said in the beginning, you may want to listen to it again, and you may want to share it with others. Also, if you'd like, please visit our website at www.hackensackmeridianhealth.com events or call our 1-800-560-9990 number. You can find some more events that'll be upcoming that you may like to join in. And thank you again all, and enjoy your evening, and please stay safe.